Good afternoon, everyone. My name is Angie. I am a patient educator here at the Cancer Education Center. Thank you for joining us this afternoon. And I just want to let viewers know that this week's webinar will be on Tai Chi, and also that we are recording this session to allow other people who aren't able to make the session that they can watch this. And just want to let others know who are currently here watching that this webinar should be available probably early next week. Just it takes us a little bit to convert the webinar and put it onto Mayo Clinic Connect. So just want to let you know about that. And then I'll be moderating this session. I also have Megan, my colleague, on, so she will be able to watch the chat to see if anybody has questions. So too, I just want to let you know that we're honored to be able to get the expertise of Sandra Nelson, who is a patient educator, not here in our Cancer Education Center, but in the Barbara Lips Mayo Clinic Patient Education Center. She retired just this last summertime in August, I believe it was, and we were able to get her to record this session that you will be seeing towards the end of the session that I have today. So just to kind of get us started and letting you know what we're going to be talking about today. So I'll be letting you know about to describe the benefits from practicing Tai Chi. We're going to be listing some principles that are important to the practice of Tai Chi. And then, like I said, I'll allow you to do an experiential learning with some Tai Chi practices that Sandy recorded for us, like I said, this last summer. So just to kind of give you a little bit background with our session today, I'm going to be talking about what is Tai Chi, the benefits of Tai Chi, how to get started with this practice. I'm also going to share some resources. I'm not necessarily an expert in this area. Like I said, Sandy was grateful. We were very grateful to her to do this session with us. But I was able to tap on some people who are more familiar with Tai Chi and got some resources that I can share with you today. And then I also want to mention that our Mayo Clinic Connect will be where I will put these resources, and I will have Megan put in the chat how you can.
Yeah, I just did it.
Perfect.
So hopefully people
good.
are seeing it, but I dropped that link into the chat for us today. Yes.
So yes, so our Mayo Clinic Connect, our Cancer Education Center, has its own blog. We'd love if you would like and follow us. We have a lot of great information on there related to cancer care or treatment. And I will talk more about that, but just wanted to let you know that she put that in the chat. Thank you. Then we'll be answering some questions if you all have some, and then we'll be kind of then closing the session by having you watch that recorded session, and then we'll just hopefully you'll be very relaxed and enjoy that session, and then we'll get out of the learning session for today, the webinar. So as I mentioned, I wanted to talk about Tai Chi. What is it? It's a centuries-old meditative martial arts practice that involves certain postures and gentle movements with mental focus, as well as that helps with breathing and relaxation. The National Center for Integrative Health has described Tai Chi as meditation in motion. And it's originally was developed in China for self-defense, but it has evolved into many people getting familiar with it as a part of physical activity. And again, as I mentioned, just to also be a part of relaxation too. So there's 5 primary forms or styles of Tai Chi, and each one of them follows the same premise, which has a combination of meditation and martial arts, but they have slight variations. So the first one is Chen. It's the oldest and original form of Tai Chi. It uses slow and quick movements, such as jumping, kicking, and striking. The second is Yang, which is the most popular form because it focuses on flexibility and it uses sweeping movements that are slow and graceful. Wu focuses on improving balance because some of the movements include extending the body forward and backward to help you with getting more balance, practice with your balance. Sun involves more footwork and is paired with hand movements that almost appear like beautiful choreographed dance. How is the least popular form of Tai Chi because it requires more advanced skill and places a strong emphasis on controlling the movement of Qi, or that's also refers to your internal force. So just to kind of let you know about the different forms. Someone had asked about what the form is that Sandy will be practicing today. And it really is what she does in the practice is she's actually doing a seated Tai Chi, which you can do anywhere. And really, I would say is the most popular form, with that second one that I referred to as Yang, because it uses a little bit of flexibility with the arm motion, and it does a lot of sweeping movements that are slow and graceful. Okay. So the benefits of Tai Chi, I looked at some research to kind of get familiar more with the benefits. We hear a lot about it, but what I have found with just looking at different research studies is there's strong or excellent evidence that talks about how it reduces falls in older adults living within the community, because Tai Chi improves static and dynamic balance. So that balance where we're either standing or moving, so it can improve balance overall. And with the Cancer Education Center, we talk about the benefits of things related to cancer, but some of these benefits of Tai Chi go into many other areas. So it's really a great practice and another kind of physical activity that we can incorporate into different kinds of activity that can be enjoyable. We've also found that it can reduce osteoarthritis pain. And Tai Chi and yoga is now a conditional recommendation of the American College of Rheumatology for osteoarthritis of the hand, hip, and knee. So there are in this type of exercise that's either with Tai Chi or yoga that are referred to as body awareness exercises. So they help us improve our posture, our balance, joint position, and even help with relaxation, because when we do it, we're really focused on what it is, our breathing, as well as really focused on the moment and the type of movement that we're engaged in. It can also improve mobility in people with Parkinson's disease compared to those who just only took medication. So studies have looked at people who just took medication and those who practiced Tai Chi and took medication, and they did see improved mobility. That Parkinson's patients that engaged with Tai Chi. It also improves cognitive functioning because, again, like what I had mentioned, you're just really focused on the movement that you're making and intentional focus on what you're doing. And that can really help us in other areas. They found good evidence with Tai Chi in that it helps reduce depression. Just because the studies that they found were a small number of subjects, but most studies were also short term. So, but all of them consistently showed positive results in improving depression. And if you think about it, it can again help calm the mind and improves the focus. Often with depression, we find that people may be so internally focused and kind of following that rumination or thinking over and over of possibly negative thoughts. And Tai Chi actually helps us kind of focus on things outward. So it can really help us in decreasing the incidence of depression. And then there's fair evidence of improved quality of life in people with cancer. And the only thing is just, it wasn't specific to just Tai Chi. We do see improved quality of life with all types of activity or types of exercise in cancer patients. So I would just say that the evidence is fair with specifically Tai Chi. So again, it's something that you can do whether you're sitting, you're walking, or standing. And that's what's great about Tai Chi, is that you can really do it in many different ways, and it can be a type of activity that meets you where you're at with your level of activity. Other studies too have showed improved sleep quality. It showed lowers blood pressure, improves overall feelings of well-being. So these are great things that Tai Chi can help us with. So how do we get started? Where I've mentioned with Tai Chi, most people can practice Tai Chi. The only exceptions that I found with reviewing information on this is that you might want to reconsider doing Tai Chi if you're pregnant. Again, I would say a lot of these things is just checking in with your provider. And the only reason with pregnant women is just because our joints can become a little bit more loose. So just making sure that those movements are safe. People, again, with joint problems, so you want to make sure that that's something that is doable for you. People with back pain, because you're doing some of those kind of forward and backward movements, may cause some additional back pain. So again, just checking with your provider. And then people with severe osteoporosis, again, because of those movements. But that's where you can do those modifications, like sitting and doing some gentle movements. The benefits of Tai Chi is that it's inexpensive. It doesn't require any special equipment. And that could be great for people if they're looking for something that doesn't cost a lot of money. It can be done anywhere. And they do see that a regular practice, you can see improvements with all of those benefits that I mentioned, with balance, improved overall well-being, decreasing incidence of depression, or just better mood in general that we see with movement. So some resources that I wanted to mention, like I said that Megan was great to put the Mayo Clinic Cancer Education Center blog. And that's where I will put all these resources on. But the first resource that I wanted, a link that I have in there, is an article on how Tai Chi can reduce stress and anxiety, increase flexibility and balance. And in this article on Mayo Clinic internet page, they do even have a short video clip. So if you wanted to see more movement in like standing poses, that is available for you. The second resource is the Barbara Lips Patient Education Center. I mentioned that Sandy is from the Patient Education Center, and she just recently retired, but they do offer a live class that you can sign up for through their center. So I wanted to give a plug out for them, along with other classes. So I will put that in Mayo Clinic Connect. And then I also wanted to just mention your local community. Any of your health or wellness facility or community classes or senior centers, check out and see if they offer Tai Chi. Here in Rochester, we have a lot of community education classes. So just check that out. And maybe you can find someone in your community that might be a certified instructor with Tai Chi and may be willing to provide a class like that. So just wanted to mention that. And then two, like videos on YouTube. I think that's one thing that I've really explored a lot recently with the pandemic, are how many videos, like for different exercise or physical activity type things that you can do. So this Open the Door to Tai Chi is something that is in our instructional videos that just have a basic type where you can see the introduction videos, but then wanted to mention where those videos are free. But then there is also like a level up where it would be a membership-based subscription beyond just those introduction videos. So again, I'll put that on Mayo Clinic Connect after this webinar. And then the other link too is Dr. Lamb. He is a Tai Chi instructor and does certification to become a Tai Chi instructor. So just wanted to mention that I'll put that in there as something else that he has videos available to. And I'll put that on there. So just wanted to mention those as resources. And then I was going to open it up before I did our experiential session. If anybody had any questions that we could, either myself or Megan could help answer.
Sure. I'll just say thank you for giving us that background and information. And as Angie had mentioned, those links that she was showing in the PowerPoint, we will put on our Mayo Clinic Connect site. So that first link that I dropped into the chat, you should be able to find it there. And then I also had sent out in the chat while you were talking, Angie, that people should ask the questions now, because we would like to do the Tai Chi experiential part of it and kind of sign off, just so you have that peaceful, relaxed state versus doing questions and answers after you become relaxed. So we talked about what would be the best way to do it. And we thought we'd try to send you off in a more Zen state.
Especially with the holiday.
Yes. So one question that came in is from someone who said, I'm in my 70s and have arthritis everywhere. I have never done Tai Chi. Which form is best to start with?
Well, I think even just starting, and the question I would ask even too, if you have a lot of arthritis, I'm thinking perhaps you're not very active right now, just because it sounds like you're possibly experiencing a lot of pain. So, I mean, the session that I'm going to play that for, after our question and answer session might be a great place to start. It's just you're seated, gentle movements. And Sandy will describe in the video that if there are any type of movements that cause pain or just doesn't feel right, always stop. Really no reason to keep pushing through that. And I would say too, that this would be a great place to start, and trying to start with maybe, again, if you're really not very active, I always say start small. So maybe once a week. And then if that feels good, then maybe in a week or two, try a couple times a week. So again, it's just taking small steps to try and increase the activity. But a seated type Tai Chi session would be a great place to start. And I bet there are even videos too on YouTube that you can find, because I know they have seated yoga too. So doing Tai Chi would be great. But like I said, it's really the most important thing is listening to your body. How are you feeling? And often if people are experiencing a lot of pain, just getting some type of movement, relaxation can really kind of help get the mind off of that pain to also feel just better in general and better overall well-being. So that's how I would answer that. Megan, do you have anything else to add?
I was going to say, I would just piggyback on that from the standpoint where you said maybe do it a day a week and build up to multiple days a week. I think the other part too, depending on where your mobility and pain level is at, is whether you can stick with a session for 5 minutes, 10 minutes, 15 minutes. So even if it's that you need to work your way into it from that perspective of just doing so much of it before you can really do the full extent, I would reiterate, listen to your body, do what feels good. And if you're feeling pain and it's not feeling good, then that's definitely a signal that your body's giving you to stop. Some of the movements may be bigger and larger, and depending on your range of mobility, maybe you can do a modified movement where you maybe don't stretch your arm out quite as far and you just hold it a little closer to your body. That still gives you benefits. And I think the other thing is when we have a body that's not cooperating as we would want it to, such as when you're a person who is experiencing arthritis, doing something that feels good and is positive with yourself feels better than focusing on the limitations that maybe arthritis is giving to you.
Very good. I like that. Thank you.
Sure. Another question that came in is, will this recording be available to watch again? And the answer to that is yes. So that Mayo Clinic Connect link that I posted in the chat at the beginning is also where you will find the recording to this session and other previous sessions that we've done as well. So within our Mayo Clinic at Cancer Education blog, there's a tab that says Video Library. And in that video library is where we're posting every single webinar that we record. So you can work your way back and see what other ones we've already had in the past. And then that's also, there's a classes and resources tab where we will be advertising our future offerings if you would like to register for any future webinars that we'll be hosting.
Yes, and the other thing that I would just mention is I said, like, give us till about early next week, just with the holiday. It might take us a little longer. As soon as we get them, we post them. But I'm just figuring a little extra wiggle room with the holiday to convert the video and have us put it up on Connect. So, yeah.
Yeah, she's right. We do put them up there as quickly as we get them back. And unfortunately, we are not the masters that convert the videos. So we have to rely on some other people to do that portion for us. So if people have any more questions, I'd say try to get it in the chat quickly. And if we don't have more that come in, I think we'll go ahead and start the session.
I do see one. Any chance, this is more related to the Rochester Mayo Clinic campus. So I apologize for other people if this doesn't relate to them. But just someone had put in there, any chance that the Dan Abraham, which is a wellness facility, offer Tai Chi for employees, because that's our employee wellness facility. I don't know that. I mean, that might be just I would ask them, I would email them that question. So yeah. No, that would be great to have that. So, and community centers too. So that's another location or other facility. So yeah, good. Anybody else? Any other questions? Okay.
I'm not seeing any others.
Okay.
So maybe while you get things queued up for the recording, I'll just keep my eye on the chat and see if anything else comes in the meantime.
Okay. Okay, you answered that one. Okay. So it's going to do that. And just to let people know too, that this session will be about 20 minutes long. So just wanted to let people know of that as well. Is my screen?
I'm seeing your screen. The other thing that I will say is that when we do a recording like this, oftentimes the audio is a little softer than what you're hearing our voices at. And we unfortunately can't make it any louder than what it is. So if you have the ability to turn your volume up, you may want to do that on your end. There is closed captioning to this video. So hopefully that will fill in the blank if you're having a hard time hearing portions of it. So we do apologize that the volume level changes, but it's out of our control, unfortunately.
Do you have the session with Sandy? Yeah, I mean the screen with Sandy.
Yes,
okay, perfect.
I'm seeing it. Yep.
Okay, so just wanted to let people know too, to give her a little plug as well. But Sandy was with Mayo Clinic for about 30 years. So just wanted to let you know that she is a certified Tai Chi instructor. And just to give you a little background on that. So here we go. Okay.
I'm so glad you're with me today. We're going to try some relaxation exercises called Tai Chi and Qigong, because research has shown just a variety of health benefits that you can get from doing these movements. The foundation of this ancient art is actually about nurturing your energy. So let's just take where we're at our desk, and push yourself back from your computer. And let's get into a comfortable mode right now, putting away everything from the past, putting away your future regrets, or your past regrets, your future frets, and just let's come into now. Feeling your legs, your hands sitting on your lap, your feet touching the floor. Just adjust your posture so you just lengthen a little bit from the spine, and yet relax the shoulders and let yourself just come into your body here and now. Notice your breath. Our breath is such a great anchoring tool. Think about and notice all the qualities of your breath for just a few seconds. Breathing in through your nose, filling your lungs from the very bottom to the top. And let's just exhale slowly and completely, getting rid of all the tension and tightness that you might have there. Let's just continue to do a few more relaxed awareness breaths before we start movement. You can even try adding an imagery to your breath. Think about something that you love to be doing, or imagine clear, fresh, vital energy coming into your body as you breathe in. And as you exhale, imagine that energy that you're finished with is just dissipating out through your pores. Perhaps it's even gray or a turbid color. And take a few more breaths, practicing visual imagery of bringing in that vital energy in and exhaling everything you're finished with. With each breath, you can get more valuable, vital energy in. You can even imagine it going into the bones and cells. And exhale, completely letting go of all the tension and melting just into this moment. The breath practice that we did can help us to just get present into this moment while we do our movements. So if your mind goes to your frets of the future or your regrets of the past, concentrate on that anchor breath in whatever way you found helpful as we do this movement. Let's go ahead and try some of the movements now with our breathing. An awareness breathing. Don't worry so much about bringing the breath at an inhale with an up or an exhale with a down. If that's natural for you, do that. But just make sure that you stop any movement if you feel any type of pain. Let's try the gathering breath together. So keeping our body again tall like a mountain, but rooted deep like a tree. Taking another deliberate breath, feeling your feet. As you begin to inhale, let's move our hands outward and upward as if we're scooping vital energy into our being. Bringing our hands up and palms over the top of our head and letting it come down as we exhale down the front of our body. And let's try that again. Breathing in as we bring our hands up and over the head. And exhale as you slowly exhale all the breath you're finished with. Setting in that calm. Breathing in as we scoop that vital energy up. And exhale completely as we move our hands down the front of the body. You can even set the palms of your hands right at about the navel level. And here is one of the energy centers in Tai Chi and Qigong called the Dantian. You can do a whole practice by just pausing here and noticing your breath. Or perhaps if you've done some movement with your hands, you can even feel the circulation or the energy in the palms of your hands as you pause here. It's a great way to end a gentle movement routine of any type. Let's do a couple more gathering breaths. Again, scooping up that vital energy, breathing in, and exhale completely as you move those hands down. In, breathe in as we go up, as you just let that new breath wash over your being. Bathing yourself just gently in this rich resource of our own breath. We can notice our breath, or it goes on without us ever even knowing, which is why we call it the anchor breath, because it helps us to attend to the moment. One breathing in, and exhale. Let that exhalation just melt into that quieting calm of the present moment. Now we're going to try a movement called calming at the center. So let's raise one hand in front of you. And I would suggest that you raise your left hand so that you're mirror imaging me. It's a little easier to do this. And we're going to take this hand that we have raised in front of us and watch our palm as we cross it to the other side. And then we're going to bring it back to the side you started on. And then we're going to think of an intention that we want to have happen in this day. And grab it out in front of you. And just imagine you're bringing that into being. And let's do the other hand. So now with your right hand up, watch the palm of your hand as it crosses over to the other side of your body. And you can watch your middle finger or the palm of your hand as you do this. It's twisting at the waist. And when you get back to center, think of an intention you want to have happen in this day and bring it in close to you. Let's try another. Again, hand in front and crossing over. Grabbing that intention and bringing it in close. Now you do this one and let you go into your own breath. And I'll be quiet as we practice at your own pace. Last one. And setting in calm. Now we're going to try a movement called cloud hands, or hands like clouds. Let's just practice this first with one hand. Let's begin though with just centering ourselves with our arms crossed in front of us. Again, your feet planted firmly on the ground. See if you can notice that right big toe and all the little toes next to your right big toe. Can you get an essence of them in your maybe sock and the shoe on the floor? What about your left big toe? Sometimes we can't notice one side and not the other. And all the little toes next to your left big toe. And what about both feet planted firmly on the floor? And now connect with the breath. Breathing in and out. Just notice how each breath is just a little different than the last. And let's just lower one hand, and we'll start with one out in front of us, like you're telling me stop. And just take that hand If you're mirroring me, it'll be your left. And dip your left hand down in front of you and bring it back up. And watch the palm. Let it come back down and dip. Now, as I'm doing this, I'm shifting my weight. So we can still get balancing energy in here even if we're not standing. So I'm shifting my weight over to the other side as I bring my hand up. And back to the other side. Like you're dipping your hand in a cool lake. Bringing it up, and the cool breeze is drying it off. And dipping. Now we're going to add your other hand. So bringing that hand up, you're going to bring the opposite hand down as the one you've been practicing with is up. And you just go opposite. Now I'm told that spontaneous Qigong is the most popular type of Qigong over in China. So right now, if you don't feel like your hands are coordinated in the same exact way as mine are, just know and enjoy it. This can just be fun. It doesn't have to look exactly the same. You keep your breath, your awareness, and your movement soft and flowing. So now you're bringing your right hand over, left hand's coming up. You can blow on it if you want because it just got to dip in that water. And we do the same to the other one. You can watch the palms of your hand. It's a very quieting gesture. And that's what I'm going to do here for a few clock minutes so that you can go ahead and do this on your own. And let's finish by crossing the arms. And we're going to actually do one of those dipping motions that we just did with gathering breath, bringing it over the top of our head and letting ourselves settle in, calm. Now we're going to try self-applied massage, which is in almost every ancient culture on our planet has some kind of system of hands-on healing. And in traditional Asian medicine, it's believed that you could balance the energy of our body by massaging either your ears, your hands, or your feet. So let's just try massaging our ears today by using the thumb and your first finger and massaging your whole earlobe. You can do this anywhere. And I always say to get in that roadway of your ear, that outer part of your ear, make sure you get in there as well. You can even take your earlobe and gently pull away from the inner part of the canal that comes out at that spot, and you can actually get quite a freshness feeling if you're feeling like it's 3 o'clock in the afternoon and you need a pick-me-up. And now let's just take our hands down and notice with me, just close your eyes for a moment. See if you can feel your earlobes. Many times, even if I haven't done it for a full minute, my ears will be tingling. That's what the ancient Chinese would call qi. As a nurse, I'd probably call it blood circulating through the ears, increasing that circulation. Regardless, it can be a very calming and grounding feeling. So let's just notice right now our hands just tapping. We don't have to pay for a massage to actually get some of the benefits of self-applied massage. You can come back to this heart-mind center, and we started on the other side as going down, so we'll do that way, and coming up the underside and back. Now you can do this anywhere on the body. And you can do it all the way down till you get to the back of your where your kidneys are in the back. And you can go ahead and do some more patting if you would rather. I feel this is much quieting, kind of like when we pat our puppy. It helps to just calm the nervous system. Again, we'll try on this side. We're going to go down underneath this time, coming up and over. That heart-mind spot is right at the chest. And we'll do it one more time. Up and over. And now let's just bring the hands back onto the lap and notice our breath for 3 repetitions of breathing in and breathing out. Notice how your body is feeling. And one last breath in and out, releasing all the tension. And let's bring our hands into what we would call in yoga, prayer posture, and think about something you're grateful for, something that always brings a smile to you. Perhaps it's a grandchild, or it's puppies, or it's kittens, or maybe it's your favorite place on the lake. Just think about that for one moment. Try to get it very alive in your mind's eye. And having gratitude for that visual image. And notice how you're feeling when we think about those things we're grateful for. And then to close, let's go ahead and bring our hands out in front of us, taking in a deep breath. My fingers are interlaced. Breathe in as you bring your hands up over the top of your head. Look at your palms. Place them up to the ceiling, again, only in your comfort limit. Stay in your comfort and bring your hands down the outside as you exhale completely. One more time, now that you know what we're doing. It's called up and out. Breathe in. And exhale as you release your fingers down to the side, setting in. And I'm wishing you well. Thank you.
With that, I'd like to tell you all, thank you so much for joining us and wishing you the best at Thanksgiving, and take care. And hopefully we'll see you at our next Cancer Education Center webinar. Have a good day. Bye-bye.